Lynn Smith in for Michaela on this Friday. Well, a new study touting the benefits of aspirin has many people confused, and actually the medical community is divided on this. So doctors have long prescribed the over-the-counter drug for people who have suffered a heart attack and are at risk of having another one. But now researchers from the University of Southern California School of Medicine say broader use of the drug could save hundreds of thousands of lives and nearly $700 billion in healthcare costs. So let's talk about this now with cardiologist Dr. Goldberg. Dr. Goldberg, thank you so much for being here. When we say broader, we're talking preventing cancer, other things like that.
Right.
What did the study find?
The study found that if you take an aspirin a day, if you're a healthy adult between the ages of 51 and 79, that it would prevent 10 heart attacks in 1,000 people and 4 cases of cancer.
So why the confusion in the medical community?
It's not so much confusion. It's a decision that you make for each individual patient. Because although it sounds great that aspirin is a wonder drug from this study, you have to also consider some of the downsides of taking an aspirin a day. Certainly the increased risk of bleeding, particularly from the gastrointestinal tract.
But when you look at things like, okay, that's one of the downsides. Are there others that would outweigh the benefit as $700 billion in healthcare cost saves, lives saved, more importantly?
Another risk that wasn't found in this study, but in other studies, showed that there might be an increase in risk from bleeding from the brain, a stroke caused by bleeding. So basically, aspirin is very beneficial. It's good for arthritis pain, headaches, reduces the risk of a first heart attack in men and in women over the age of 60, and it also prevents second heart attacks in men and women. And now lots of evidence that it might reduce risk for colon cancer. The best thing a person can do is talk to their doctor about whether or not they're a candidate for aspirin. And people should know that before just buying the bottle of aspirin and taking it yourself, you should talk to your doctor about whether it's beneficial for you. I want to point out another important fact from the study is that they found that 40% of people who should be on aspirin aren't taking it. So we need to do a better job in encouraging people to take their aspirin.
Well, but you talk about some of those downsides. I mean, you talk about bleeding in the brain and things like that. Who does that apply to? There are millions of Americans out there taking aspirin every day now. So should you be concerned?
Well, in general, it's a risk, but not a very large risk. And important ways to prevent the bleeding episodes is to make sure you're not taking too many over-the-counter blood thinners. So if you're taking aspirin, then you probably shouldn't be mixing that with ibuprofen or naproxen. A lot of my patients buy over-the-counter fish oil and are on aspirin and other blood thinners, and that can increase risk for bleeding. So it's really important to share that information with your doctor.
Yeah, and sort of figure out whether or not you're the candidate for this, because if you're not, it could be a problem. Dr. Goldberg, thank you so much for joining us.
You're welcome. It's best to be the person who needs the aspirin and take it.
There you go. Thank you so much. You take care. Have a good weekend.
You too.